Welcome to the Triactive Laser Dermology Treatment Series. The Triactive Laser Dermology System is the first system to incorporate lasers as well as massage. The Triactive is easy to use, but it does require proper technique. The strokes are demonstrated in this video, as well as in our clinical manual and clinical posters. We will use the large Triactive handpiece. This handpiece has two distinct inserts, one being the shape of a large oval, while the other is more rectangular in shape. As with the lower body or abdomen and back treatment, we will use the more rectangular insert. The oval insert is used for sensitive areas and in post-liposuction contouring. The complete treatment cycle will require 12 to 16 sessions, each lasting approximately 15 minutes, performed twice weekly. Monthly treatment is recommended to maintain the desired results. We are about to begin the arm treatment. As with all Triactive laser dermology treatments, we will begin with the opening phase, which stimulates the lymph nodes to receive the fluid as it is mobilized during the treatment. Opening phase. For the arm treatment, begin with the client lying on the bed face up or in a supine position. Turn the laser on and set the frequency to 5 Hz and the duty cycle to 50. If the client experiences discomfort, you may need to lower the duty cycle. Use the treatment handpiece with the rectangular chamber, placing it perpendicular to the direction of the movement. Start by opening the supraclavicular lymph nodes by the clavicle. You will want to keep the treatment head parallel to the skin. Beginning on the right side of the chest, make 3 medial to lateral strokes. Continue on the left side of the body, making 3 medial to lateral strokes. Stimulate the axillary lymph nodes beneath the right underarm by doing 3 upward strokes. Then, stimulate the axillary lymph nodes beneath the left arm by doing 3 upward strokes. To begin the arm treatment phase, you will do a medial lateral stroke from the inner to the outer part of the arm, snaking up the arm, starting slightly above the elbow and moving toward the shoulder. Repeat this sequence 3 times. Next, you will do 3 slow longitudinal strokes up the arm, starting from the inner part of the arm and moving outward. Depending on the size of the client's arm, you may have to alter the amount of strokes. Repeat this sequence 3 times. Now move to the left arm. Again, moving medial to lateral with a slight arc inward, snake up the arm from elbow to axilla. Repeat this sequence 3 times. Then do 3 slow longitudinal strokes up the arm with a slight arc inward as you did on the right arm. Repeat this sequence 3 times. Have the client turn over to the prone position, lying face down. Starting slightly above the left elbow, medial to lateral, snake up the arm to the axilla. Repeat this sequence 3 times. Now do 3 slow longitudinal strokes up the arm, medial to lateral. Remember, you may have to do more or less strokes depending on the size of the client's arm. Now, move to the right elbow and begin snaking up the arm, repeating the previous motion from elbow to axilla. Repeat this sequence 3 times. Again, do 3 parallel strokes up the arm. Repeat this sequence 3 times. Once the arm treatment is complete, have the client turn back over to a supine position and proceed to the closing or discharging phase of the lymph nodes. You will repeat the process that was used in the opening phase, but in the reverse order. You will once again use the rectangular chamber on the handpiece. Be sure that the laser is on and the frequency is set at 5 Hz and the duty cycle at 50. Begin now by stimulating the axillary lymph nodes on the right side. Do 3 upward strokes. Now do 3 upward strokes to stimulate the axillary lymph nodes on the left side. For the final phase of the closing, move to the supraclavicular lymph nodes by the clavicle. Beginning on the right side of the chest, make 3 medial to lateral strokes. Continue on the left side of the body, making 3 medial to lateral strokes. This completes the Triactive Laser Dermology arm treatment. Please remember to refer to your manual or posters, as they will help guide you during the treatments.